Welcome to Dr. J's Prescription for Health. I am your host, Dr. Malea Jensen. Well, this is your opportunity to ask questions, medical questions. I am a family practice physician, and I am located in Des Moines, Iowa. As a reminder, this is not medical advice. It's for information purposes only. So with that being said, I am ready to take your questions. I do have some questions that were built up from yesterday that I thought I could start off if you guys don't have any immediate questions. The first one being that in regards to salt. Someone asked yesterday about salt and how I feel about salt. I personally love salt. I personally use salt. I salt things to taste. If you are thinking about doing a carnivore diet, you're thinking about lowering or going no carb, I think initially it is very important that you use salt. And I would prefer that you would use a mineral salt, not like table salt. The salt will help because when you go carnivore, initially, you are going to lower your insulin levels. And insulin is notorious for holding on to water and holding on to salt. So when you lower carbs, you're going to lower insulin, and then you're going to get a natural diuresis. And that diuresis of water and salt will put you in, it could put you in a state of hyponatremia, sodium in the blood. So taking or using salt or using an electrolyte early on in your carnivore diet would be in your best interest. If you are on blood pressure medicines, you need to, and you want to consider a carnivore diet, please talk to your doctor. If your blood pressure is due to you having metabolic syndrome, you're insulin resistant, when you lower your carbs and the insulin starts coming down, your blood pressure is definitely going to come down. And so you might not need your blood pressure medicine, or you might not need as much. So it's very important that you tell your doctor that you're going on a carnivore diet. Know what a carnivore diet is? Let me tell you that when you go on a no carb diet or low carb diet, insulin will come down, blood pressure will come down. You guys make the decision on what you want to do with your blood pressure medicines. We are live on Instagram and YouTube. So those of you who have questions, put a Q in front of it so I know if you have a question or not. Good morning, Melanie. And Giselle, we do not do requests for live videos unless I have that planned in advance. Good morning, Hema. And Nancy. Let me see. Did I miss any questions? Instagram, did I miss any question? Good morning, Tommy. And hello from England to Pete. Pete is listening from England. Let me see. Okay, we will go on. And question is, how does insulin play a role in cardiovascular disease? Well, I think insulin plays a role in many diseases, including, Alzheimer's, hypertension. I mean, it plays a role, obviously, in cardiovascular disease, in diabetes, but specifically, the root cause of cardiovascular disease, I believe, is insulin resistance as one of the factors. What time is it in Iowa? It is 10:05 a.m., so we are in Central Time. So root causes of cardiovascular disease, insulin resistance as the main. Number 2, poor sleep. Number 3, stress or increased sympathetic tone, increased sympathetic drive, cortisol, and your norepinephrine, epinephrine, so adrenaline. Ultra-processed foods are a risk factor for cardiovascular disease. Ultra-processed foods or processed foods in general have high amounts of sugar, high amounts of polyunsaturated fatty acids in the form of omega-6 linoleic acid. We are getting way too much linoleic acid. We need it. It's an essential fatty acid. However, our ratio of omega-6 to omega-3 should be 1 to 1. And when we are consuming a lot of ultra-processed or processed foods, the amount of omega-6 could be upwards to 20 to 1. I've even seen some labs indicate that when I obtain blood, that their level of omega-6 to omega-3 ratio is 29. That is very high. Yes, Richard, that is another cause of cardiovascular disease, smoking, any type of drug, alcohol. Yep, thank you for chipping in some information. I appreciate that. Good morning, Luis. Here's a question on excess sweating with body odor. Those are toxins, and your body is trying to eliminate. Sweating is one of the ways that we release toxins. It's very important. Sweating also increases our ability to produce nitric oxide. But the fact that you have odor is usually due to what you are consuming. MM is say, yay, I'm planning to stop smoking in January. That is awesome. Congratulations. Let's all pray for MM so they can quit their nasty habit of smoking and reverse any damage that smoking might have done and improve their health. Jason says, I like cheese. There's a lot of people that like cheese, Jason. Dr. B, I saw you on here yesterday. What are you a doctor of? Good morning and happy Sunday to you too. Jerry is blessed says he puts salt under his tongue every morning, Celtic salt. Jerry, I don't know the statistics on Celtic salt right now. I go back and forth. I had a patient, or not a patient, I had a consult this past week who told me they've been watching the amounts of heavy metals that are in salts, and they actually suggested that Celtic salt, as well as Redmond's, are very high in lead, and they suggested Jacobsen salt, which is one of my favorites. So I have been using Jacobsen salt for a while. I will continue to use it until I find out that it is also high in lead, and then we'll find something else. Yes, Richard, smoking does increase cardiovascular risk. What about it? It's changing the endothelial lining. It's an injury to the tobacco or anything smoked. It could be, you could be actually at a bonfire, and that smoke from a plant increases your risk of an injury. When we have an injury to the endothelial lining, to the glycocalyx, we've talked about the glycocalyx extensively in previous live streams. The glycocalyx is the innermost lining of the artery. And so that is the first lining of defense. And it's fairly thick, but over time, smoking can, or any type of plant smoke can decrease the thickness of the glycocalyx. It injures it and it causes it to dwindle down. Alcohol can do the same thing. Sugar can do the same thing. Heavy metals, like sickle cell disease. If you have sickle cells, your red blood cells are shaped like sickles, like knives, and they cut into that glycocalyx. Heavy metals, nanoplastics can destroy the glycocalyx. Once that glycocalyx is destroyed, the next lining to be affected is the endothelial lining. And that lining is only one cell layer thick, and it's very tender. We need that lining, okay? Richard's also asking about drugs like marijuana. Again, those are plants, and anytime plants are smoked, you could get damage to the endothelial lining. Venkat is joining us. He is Indian. I'm guessing he's from India, and I am in the United States. Muffy says, how do I heal diverticulitis naturally? My bestie has it very bad and needs to eat. Diverticulitis, itis, is inflammation of diverticuli. So the question should be, how do you improve or heal diverticuli? Diverticuli are outpouchings of the colon lining. So they are little caves where the lining of the colon has been injured or destroyed. And with that being said, when these little caves or pooches, things can get stuck inside of them, and seeds can get stuck, popcorn husks, different types of food can get stuck in these caves, and then it festers, gets infected, and then an antibiotic is probably the best case scenario. Again, if you've got diverticulitis, you really should be talking to your doctor. If you have a condition of diverticulosis, osis means a condition of diverticuli, you have to ask yourself what is causing the diverticuli. Is it high glucose? Is it insulin resistance? Is it, that's the most common. Carbohydrates cause inflammation, and inflammation is the main source of why we get problems in our colon. Sherry says, my husband has divertic and he's wasting away. You should see your doctor. He should see his doctor. Chanel is tuning in from Mongolia. Welcome. Thank you. Hi, Tony. Okay. Dr. Be Healthy is internal medicine, mostly geriatrics, anti-aging wellness, lifestyle modification, always before pharmacological intervention. I like to hear that. And where are you listening from, Dr. Be Healthy? I am in Iowa. Janie says, can you please explain why a doctor would wait for a follow-up appointment after telling your sister she has experienced a heart attack? Janie, good question. I don't think I can speak for that doctor. I don't know why that would occur. Yeah, you're welcome, doctor. Baja Gold. Pipkeeper uses Baja Gold mineral salt. This last consult, they did tell me that Baja Gold is high in lead, so please check it out. I can't remember the website that she told me, if she told me at all. I can't remember. Sasha's listening from Canada. It's very helpful information. Thank you. You're very welcome. Muffy says, I didn't think about insulin resistance. Thank you. Prayers for the other commenters as well. Oh, that's nice. Thank you. And I'm sure that they're thankful for your prayers. I appreciate that. But yeah, Muffy, the obtain an insulin level, an A1C, chem profile. I would get a check thyroid. There's a lot of things. Oh, thank you, Pipkeeper. Pipkeeper just donated, it looks like, came to $20.91 for my rescue, rehab, and rehome. It's not mine. It's a rescue that I support because that's where I got my tallow. Tallow as in my dog, not tallow, my meat, tallow. But yeah, tallow loves tallow, I will tell you. He loves butter more than he loves tallow. I give him just a tiny little bit every morning, and he thinks that that's the bomb. So thank you, Pipkeeper. I appreciate that. Hema says, good morning, doctor. My ApoB and LP little I are very high. Okay? ApoB will go high if you have high LDL. What is your LDL? Your triglyceride and HDL are very good. Okay, I don't know what very good is, and I don't know what very high is. LP little a is very high. I don't know what very high is. A1C is 5.7. That's pretty high. I mean, normal would be 5.0. 5.7 is prediabetes. I don't know what kind of diet you're on. Good blood pressure, I don't know what good is. Good thyroid function, I don't know what good is. I am lean, overall in good shape, eat low carb. Hema, if you want me to go over your blood, I would be happy to do a consultation with you. Hema says, help me as my doctor wants to put me on statins. Okay, well, we can go over it. Sign up for a consultation. Just email me at IronLadyDoc@AOL.com, IronLadyDoc@AOL.com. Let's see. Sherry says he's had 3 colonoscopies on 3 meds. It's still bad. His bowels still get stuck. Well, there's got to be a reason. You know, that is something that you or him and he and his doctor need to really go over. Without having to go to a doctor. Well, folliculitis, itis is inflammation of the follicles. Is it due to candida? Do you have a fungal infection? Is it bacterial? Is it, those are usually the most common causes. There was, cute story, there was a, when I was visiting my dad, when he was alive and he was in a nursing home, there was a gentleman that lived across the hall who had this problem. And I told, he had some dementia. And I told his nurse that, you know, because no one was really treating it. And I told his nurse, I said, you know, nurse, if you just get a little bit of Selsun Blue, I mean, the real McCoy, Selsun Blue. So it is selenium sulfide. And you rub that into the beard, let it foam or suds, and you leave it on for a couple minutes and do that 2-3 times a week. Usually the tinea barbae usually goes away. The folliculitis goes away. I would suggest to you in some point you should shave that beard and treat your skin. But maybe see your doctor about that. Pipkeeper states, Dr. David Duarte from Mexico recommends 5 grams of sea salt per 1 liter of water. So 5 grams is, Pipkeeper, is how much? 1 teaspoon of water. And I have applied it to my routine and it's been wonderful. Did a 3-day fast with no problem at all. Energy all-time high. That's awesome. Thanks for letting us know. Thanks for sharing your thing, the things that help you. And so Pipkeeper will sometimes do fasts, and when he does do fasts, he will use salt water. TM, thank you, Dr. Iron Lady. I will work to reverse my MS. You're very welcome. Thank you for joining, George. Richard. Okay. Richard says, I see a lot of incorrect diet information about things like carnivore diets and raw water. Raw water? And that plants are poisonous. What would you say about these diets and other pseudoscience online? So I need some definitions. You see a lot of incorrect diet information. What is incorrect diet information? You see that, I don't know what raw water is. Help me with that. What would you say about these diets and other pseudoscience? What is pseudoscience? Who's defining the pseudoscience? What diets are pseudoscience, and who defined the diets as being pseudoscience? Are those your words, or are those the words of whoever is following a diet and all other diets are pseudoscience? Yeah, I can't answer that question. Ryan has a sense of burning in his feet. He likely needs to get some labs done. Ryan, if you need a list of good labs, email me at IronLadyDoc@AOL.com. David says, love the glasses. You're beautiful. Thank you. I appreciate it. Let's see. Nancy says, will a calcium result of 0 at 66 give me a peace of mind? I think, Nancy, that a score of 0 at 66 would give you a good peace of mind. Yes. Dr. B is in South Florida, internal medicine. South Florida deals a lot with anti-aging. That's awesome. Thanks for following. I don't know if you're following, but thank you for following. If you're not following, please click the follow button. I appreciate it. Hema says, I did email you this morning. Looking forward to meeting with you over Zoom. Okay, awesome. Yes, I will check my email. Sometimes I stay away from it on weekends, but yeah, okay. Ahmad is from Pakistan. Welcome, Ahmad. Amir has bloating and stomach problems. I would look into your diet and what's causing that. Colin is from Trinidad and in the Caribbean, and he does keto from time to time. Welcome, Colin. Brad asks, what causes ADHD? I think many things cause ADHD, but I would look into getting some labs, and then we can go over it if you would like to get or sign up for a consultation at IronLadyDoc@AOL.com. Thank you. Ahmad will email me. Okay, great. I will watch for it. Brad says, anti-aging, huh? Are there restorative therapists targeting DNA damage? I think that's, Brad, that is probably a question for Be Healthy. I think I'm live on Instagram and Facebook, so the reason you might not be, or excuse me, I'm live on Instagram and YouTube, so the question, you might not be seeing the questions over on Instagram, and I'm reading them off. So Be Healthy runs an anti-aging clinic. Now, I think more appropriately would be to say, we're trying to slow the progression of aging. I don't think that there is such a thing as anti-aging, meaning you're not going to age. I think every day that you are alive, you are aging. Now, how fast is another question. Okay. Face IO or I0, I think it might be fungal because I just treated tinea versicolor. Now 3 little bumps appeared and I barely have any beard, but I'll try what you recommend. Thank you, Iron Lady. You're very welcome. Selsun Blue is amazing. You can't use Head and Shoulders. Selenium sulfide is the answer, but you need to treat it. You're going to get some dryness. That's why I say maybe every 3 days, because you might not be able to tolerate it. If you're tolerating it, you might be able to go 3 days in a row. But I have seen miraculous improvements with Tinea barbae. It's pretty amazing. Richard says, by incorrect diet information, I mean that some people online swear that a meat only or meat and dairy only is appropriate for everyone. Well, but who's defining incorrect? And what is the definition of incorrect? See, that's where I'm getting at. You're putting words in people's mouth by stating that something is incorrect, but yet not defining why it's incorrect or who labeled it as incorrect. That's all I'm asking. Raw water is unfiltered groundwater. Okay. Richard, if you are doing well on a correct diet and you're doing well on raw water, unfiltered from the ground, kudos. Continue. Hafiz says, fatty liver diet, please. Low carb, no fruit, no alcohol. Low carb, maybe no carb. You have fatty liver because insulin is causing fat to accumulate around. Insulin is causing fat cells to get bigger and to accumulate around your liver. And if you got fatty liver, you got fatty pancreas. If you got fatty pancreas, you likely got fatty kidney. If you got fatty kidney, you likely have fatty heart, and you got fatty tongue. you have insulin resistance, if not already diabetes. Most people who have fatty liver also have diabetes. Their doctor might tell them they don't have diabetes because the doctor doesn't diagnose diabetes until it's over 7.0. That's a crime. Walter says, your opinion on statins. Walter, what is your opinion on statins? Statins have effects. What are those effects? Statins lower cholesterol. They lower all cholesterol. Okay? You have to ask yourself, do you have a cholesterol problem? And if you think you have a cholesterol problem, why? Then statins decrease inflammation. If statins decrease inflammation, why do you have inflammation? And couldn't you just lower the inflammation instead of taking a statin to lower the inflammation? Okay? Number 3, statins decrease the risk of blood clots. What increases the risk of blood clots? Fatty liver. So how do you decrease fatty liver? You get rid of fruit and you get rid of glucose. Fructose and glucose increase insulin. Okay? So sounds like the problem, or what might, I don't know what you want me to say about statins, but that is the things that statins can do. Now, if you have blood clots and you have inflammation and you have tried to lower why you have those things, and you still haven't been effective, maybe you need a consultation. We can go over it. Okay, Walter? IronLadyDoc at AOL.com. How can I treat candida? Stop feeding it. What do candida eat? Glucose. Boiling Frog must be talking to somebody. Don't drink, don't smoke, eat healthy. Awesome. Dr. B says, true, we try to slow the effects and progression of aging by implementing lifestyle modification and using proper supplementation, peptides, hormone replacement as appropriate where indicated. Very happy to see the FDA is removing the black box warning for women's HRT recently. Drive to engage. Can Hashimoto's thyroiditis be treated? Depends on what is causing your Hashimoto's thyroiditis. Hashimoto's is considered an autoimmune disorder. What is causing autoimmunity? Inflammation, metabolic dysfunction. There are things going on that are causing rise of antibodies that are going against your thyroid. But why? You're very inflamed and there's a lot of things going on. I would love to look at your other labs. Most doctors treat Hashimoto's with synthetic thyroid, synthetic T4. And Hashimoto's is more difficult to treat. It's harder to treat. Sometimes you have to add a little T3 because the T4 to T3 conversion in the periphery is not working very well. There also could be some conversion from T4 to reverse T3. And that is not a good thing because then you have lower T3. Mike says, how do you reverse diabetic neuropathy? Getting rid of your diabetes. Diabetes is a disease of carbohydrate toxicity. So if you remove your carbohydrates, likely your neuropathy will go away. Good morning, Justin. Wayne says, I have lost over 200 pounds on carnivore. Congratulate Wayne. He had 200 pounds to lose, and he did that with carnivore. But he lost it so fast, everyone around him is worried. So now he's maintaining his weight. How long do you think I should wait before starting back fasting? So I didn't know you were fasting. You said above that you're carnivore. So you were carnivore and fasting? Yeah, I don't understand, Wayne, but congratulations. Joe says, anyone ever get diabetes eating lots of fruit? Fruit is fructose. A1C does not measure glycated fructose. A1C measures glycated glucose. A1C measures glycated glucose, not glycated fructose. A person could be eating a ton of fruit and they will have a normal A1C. Tons of fruit, fructose bypasses all processes of like glucose metabolism, goes directly to the liver and causes fatty liver. Fatty liver leads to fibrosis. Fibrosis leads to cirrhosis and perhaps even liver cancer. I don't think that fatty liver is something that you want to have. Let's see. Pipkeeper says, I did recently a scan at a local place, so local outpatient radiology, and I have 0.71 visceral fat. I'm looking forward to getting a calcium score next. Awesome. Dr. B is heading to the gym. Always enjoy your content and your lives. Have a blessed day. You too, Dr. B. I appreciate it. Lucy says, greetings, Dr. J. Think of your mom often. So happy she has you. So happy we have you too. Looking good. Looking good, Dr. J. Well, thank you, Lucy. Your profile picture makes you look awesome as well. So welcome and thanks for being here. I'm trying to read through some of the YouTubes. They go so fast. Wayne says, yes, I was carnivore and fasting doing OMAD. And you lost 200 pounds in how long? How do I lose stomach visceral fat? Low carb or no carb? Drive to Engage says one should not eat fruits at all. Drive to Engage, you need to decide for yourself whether or not you want to eat fruit. Fruit is a combination of fructose and glucose. If you want to consume fruit with glucose and fructose, then by all means, go for it. If sugar used the real stuff, what's real stuff? At least your body processes it better than refined crap. Well, the fruit of today, modern fruit, is refined crap. So again, you have to make that decision for yourself. 10 months losing 200 pounds. Again, congratulations. I don't know why you're worrying about people around you. You should be worrying about yourself. If you think you've lost it too fast, then slow down. Yummer says, I have iron deficiency. I get lightheaded when I stand up. Sounds like you need to see your doctor and get some labs. Chat with Lucy. Glad California weather is finally cool enough to wear my Dr. J hoodie. Any more merchandise available? No, I still have, I believe I have 4 hoodies left. Two of them are that kind of a ash gray, and 2 are the charcoal gray. And if I remember correctly, Lucy, you bought the charcoal gray ones. I believe I have large and extra large left, and I will do a total, I will send them out to you if you're in the United States for $35 total. That'll include shipping and handling. So I have 4 of those left. I sold all of my beanies. I sold the coasters, of course, to yourself, and maybe we should, for the first of the year, Lucy, maybe we need to work on some more apparel. And how what would look good. And I think the other Lucy, who you also know, might be able to help us with that. Okay. Good morning, life coach. Appreciate you being here. So, okay. I am live on Instagram and YouTube. As a reminder, this is not medical advice. I see that there are other people on both of these platforms that are giving medical advice to people. Again, this is not medical advice. This is for information purposes only. So take all of that with a grain of salt, including all the information I am giving. There's some entertainment thrown in as well. Oh, here's a good question on nitric oxide production. Okay. Nitric oxide is a chemical that is produced in the endothelial cells of our arteries. And nitric oxide, when released, it actually acts like an antioxidant, and it's also can act as an anti-infective, so it can help fight infections. There is strong studies show that nitric oxide helps to vasodilate our arteries and help reduce hypertension, cardiovascular disease, stroke. It being an antioxidant, it can be sucked up in other ways by, where it's not available to be used for vasodilatation. Okay, I'll get to your question, Ruth. Nitric oxide is produced by bacteria in our mouth. So that's why many people online tell you not to use antiseptic mouthwashes, because it destroys those bacteria. Sun helps our skin, helps to increase the amount of nitric oxide that our body, our arteries can produce. Also, red light therapy has been shown at very high wavelengths, has been shown to increase nitric oxide. Can you take nitric oxide? There are people who sell nitric oxide over the counter. There is. And you have to decide, do you want to take the beets, or do you want to, do you want to eat beets? Do you want to take concentrated beetroot? Do you want to take L-arginine? Do you want to take L-citrulline? I probably would take L-citrulline over L-arginine. L-citrulline malate would be the best option. What do beets have? They do increase nitric oxide. Again, these are things that, you have to decide for yourself, whether or not, as we get older, the amount of nitric oxide probably is going down. And the things that we do, and so if you're a very highly inflamed person, you're going to be using up your nitric oxide in places where it's going to take away from where you really need it in the arteries. Madge says, I've always been a sugar seeker and have defended my fruit choices, but this last week I ran out of fruit and have been too busy to buy more. OMG, I am 5 pounds lighter just from water weight. I'm sad. Oh, I'm sorry to hear that. Madge did not want to lose 5 pounds. Madge loves her strawberries and mangoes. Awesome. Okay. Oh, here's another question in regards to the nitric oxide and blood pressure. We have to be very conscientious on how you're checking your blood pressure. That I'm stating that right now. When you go to your doctor and they check your blood pressure and then they tell you it's elevated, if you just, got out of your car, you were in traffic, you were running late, and you came into the doctor's office, you sat down for 5 minutes, then they rushed you back, and then they took your blood pressure, and they're talking to you, and they're doing whatever they're doing, asking you a bunch of questions, that is not the correct way to take your blood pressure, okay? You should obtain blood pressure when you're calm. I would sit for 15 to 20 minutes. Your feet should be flat on the floor. You should not cross your legs or cross your feet. They should be flat on the floor. You should empty your bladder before getting your blood pressure taken. That alone, a full bladder can raise blood pressure 3, 4, 5 points So empty bladder, feet flat on the floor, calm, at least 15 to 20 minutes. No talking. And then let your, the nurse take your blood pressure. So as a review, urinate and empty your bladder. Feet flat on the floor. Sit for 15 to 20 minutes to calm down. And don't talk. Don't let the nurse be asking you questions while she's taking your blood pressure. She can't hear anyway. That's dumb. Evelyn says, I'm checking nitric oxide levels. My blood pressure is 206 over 112, now down to 124 over 67. Wow. Carl says, after prostate removed, will ED ever improve? So your ED was bad prior to your prostate being removed? Is that what you're saying? Or you got your prostate removed and then you got ED? I would say that any TURP, a transurethral resection of the prostate, leads men into a situation where they're impotent because of the nerves that have been destroyed. So I don't know the answer to the question because I don't know if you had ED prior to your prostate being removed. And why was your prostate removed? Did you have cancer? Good morning, Bendover. Huh. Did you guys get that? Evelyn says, red, purple foods, hibiscus tea, drink beet juice from canned beets, no doctors. Good for you. Reggie says, what are your thoughts on GLP products? Well, why, for what, Reggie? We have GLP in our body. GLP is produced in our GI system. There might be a few other areas that GLP is produced. GLP stands for glucagon-like peptide. Glucagon-like peptide. I would have to get more information on what are your, just giving my thoughts on GLPs, but for what? Carl says, yes, I removed it for cancer. I'm sorry to hear that. Carl says, ED wasn't too bad before surgery, but you still had it. So, Carl, that leads me to think that you had some insulin resistance prior to getting ED. So if and cancer, feeds on sugar. So it'd be one more thing. Carl, I'm guessing that you're either pre-diabetes, diabetic, insulin resistant, all of those things that may have led to your prostate cancer or encouraged prostate cancer to grow and thrive. Evelyn says, I lowered my A1C to non-diabetic. I don't know what non-diabetic means, by eating rice and fruit. Well, your A1C doesn't measure fructose. So sorry to hear about Evelyn, you probably should read up on that. A1C only measures glycated glucose. And you really should check the health of your red blood cells. If your red blood cells are not healthy, then yeah, your A1C is not accurate. Really should get an insulin level and a blood sugar level. Let's see. Sika says, what's your vitamin D level? Well, what is your vitamin D level? Why are you asking what your vitamin D level is? Are you asking me your vitamin D level? Reggie says GLP for supporting weight loss. Supporting weight loss? Does that mean that you are obese? And also to cut cravings. GLPs does not cut cravings. It causes satiety. It's not going to tell you what to eat. It just tells you to eat less. So it's not going to cut the cravings for things like smoking and drinking. Although for you, Reggie, it might. I don't know. There has been some anecdotal evidence that has shown that people on GLPs also find less craving for smoking and drinking. That could be you, Reggie. I don't know. Everybody reacts differently to GLP. With Lucy says, I'm back on HRT. Doctor is going to add progesterone and testosterone. My hot flashes and headaches unbearable. Is testosterone safe for a 67-year-old woman? Thank you. Headaches are daily, probably due to nasty chemo. So the question is testosterone safe in a 67-year-old woman? I don't know, Lucy. I don't know what dose they have you on. I don't know what your definition of safe is. You have to ask yourself, why you're taking it. Crystal says, doesn't chromium cut cravings? I have not heard that. I would have to look into it. What form of chromium? Which form? Is it the trivalent chromium? Is it, which chromium? Which chromium salt of the chromium? Those would be good questions. So I can't answer your question, Crystal. I don't know the answer. Reggie says things like Zepbound, which is a combination of, or it's tirzepatide, which is a combination of GLP, GIP, are now being used to help opioid addiction and smoking. Jake says, don't they do lab panels months before surgery? Who's they? And what labs? What surgery? Ken says, I got the worst restless leg syndrome, have since I was a kiddo. Always have normal iron panels. I don't know what normal iron panels is to you. Doc wanted me to take low-dose methadone. No thanks. Same with dopamine agonists, not for me. So I'm guessing your B vitamins are fine. And I'm guessing you're not insulin resistant, which is anything over an insulin level of 5. If I get the diabetes under control, will that change the ED? Only you can tell us, Carl. If you get rid of your diabetes, likelihood of ED improving, not going to be there, is higher than if you continue to have diabetes and keep your ED. Oh, geez. I love how you guys, some of you like to be the doctor on here, or just the expert. How about that? We have a lot of experts. Crystal says, can I get off L-Dopa? I don't know why you're on L-Dopa. Sika says, my doc says my vitamin D is 40. Is that America? In America, a level of 40 or where? Thank you, Lunar. Jake says, started an NAD plus. What is the plus? You're getting it sub-Q as part of an anti-aging. You mean slowing down the progression of your aging, or are you actually in reverse, Jake? All of us would be interested to know if you've actually taken years or days or hours off of your age. We would love to know simply by putting NAD plus. What's the plus? And how much sugar is in that? Is it, I think there's some things that you need to learn about NAD, Jake. Hot Donnie says, Ken, try some magnesium for your restless leg. Ken already takes magnesium glycinate, so. Good morning, Boston Barry. I'm glad you're here. Yeah, Jake, I've never heard of methadone for restless legs. Okay. Lucy says, my son is hitting, let me get rid of this. My son is hitting the sauna on a daily basis. His skin looks great, but is daily safe? And I guess it would depend on how much he's sweating, just making sure that he's got his electrolytes checked. But I don't even know how long he's in the sauna, Lucy. I mean, if it's 5-10 minutes to warm up, get a little bit of sweat going, I think that looks fine. But yeah, I'm guessing he's releasing a whole bunch of toxins, and his skin is the first to show it. RJJ, I'd have to look that up. And is it PYY or is it PPAR gamma? I'm not sure. Okay, vitamin D level USA standard at 40. Most people, the goal should be, upwards to 100. A low vitamin D level at 40, you would have to ask yourself how, if you're overweight and have fat on your body, the fat on your body, because vitamin D is a fat soluble vitamin, it can be sequestered in your fat. If you don't take vitamin D with fat, you're also not going to absorb it. But, getting out in the sun is probably the best thing you can do. Is fish oil good? 2,000 a day. I don't know what kind of fish oil you're taking. If it's in a capsule, it's likely already oxidized, so it's rancid before you even put it in your mouth. So if you're eating the fish with the fish oil, that would be great. But as far as if you're asking about 2,000, I think studies have actually gone up to 8,000 milligrams of omega-3 fatty acids for health benefits. Lucy says, woo, relieved you don't oppose daily sauna. Yes, son does electrolytes and is looking fit and skin is fabulous. Awesome. Travel and Learn says, best time to use magnesium glycinate. I think it depends on what you're using it for. If you're using it for sleep, maybe taking it at night, but some people take it twice a day. Jake, I understand that NAD is a coenzyme and not sugar molecule. However, many places who put it in their therapy, it needs sugar to get it to do its thing. Very high dose, it spikes insulin. Madge, I don't think that any over-the-counter fish oil gummies or capsules are stable. Okay. Sika says, is 10 milligrams creatine daily good for brain health? I've heard that. 10 to 15 milligrams, actually. Studies have been using creatine. I think if you're eating a meat-heavy diet, you'll probably get all the creatine you have, but you have to ask yourself what caused the brain dysfunction in the first place. If you have poor brain health, I'm guessing that, the brain and going into cognitive decline is due to diet. Janie says, I have some pain in my right knee, so I went to the chiro. It helped a lot. Also doing PT, mobility exercises. Wondering if a deep tissue massage would be helpful. I'm trying at-home remedies. Yeah, I don't know, Janie. Maybe try the deep tissue massage, but I don't know what's wrong with your right knee. What is the diagnosis? Did you have x-rays? Do you have do you have good joint space? Is your meniscus healthy? Is your ACL, medial collateral, there's all the anatomy of the knee joint. Is it all intact? So I don't know what the diagnosis is. I'm glad the chiropractor is helping and doing some mobility exercises, but again, I don't know what the diagnosis is. Okay, Lucy says, a doggy question. How long do we cook our fresh meat for my dog? Should kibble be on minimum for his digestion? What is it? Why do those two things have to go together? I don't know. So you're telling me if he eats meat, then he needs something for his digestion? A meat-only diet, their digestion is quite fine. I mean, you're talking to a carnivore, which is a dog, which is supposed to eat meat. That's what it does out in the wild. They're called coyotes and wolves. And so they only eat other animals, so only eat meat. I don't think they're searching around looking for some kibble with crap in it for their digestion. I'm not sure, but that doesn't sound like something that is relevant. Now, if you think that you want to give them processed kibble to maintain digestion, I'm guessing you're talking about a bowel movement. So you're stating that in order for my dog to have a bowel movement, you need to give them some wasted nutrients or wasted not nutrients in order for them to poop it out so you feel good about yourself. That's a possibility. You can do that. How long should you cook it? They can eat meat raw. They do not cook their meat out in the wild. I don't think they put their meat over a hot stove. But again, I could be wrong. Yeah, Ken, I suppose that you're probably right. Lucy, Ken says you have to also realize that they're eating the entire animal if they get that far, okay? Usually they will not just eat what Ken says is the lean parts of the body. They will be eating the fat and the fur, and they'll probably chomping on bones and doing all that. But usually, I mean, if you've watched Animals in the Wild, and I've never watched them, but I've watched on YouTube or channels on TV where when they kill an animal, one of the first things that they dive into is for the organ meats. Lucy says, should we only be feeding him fresh meat, eliminating kibble altogether? He's healthy. Hubby says no kibble, should be strictly carnivore. Thank you. Yeah, I mean, you don't have to just do meat. I mean, dogs love chicken. They love poultry, all sorts. They do love turkey. They'll eat fish. If you give them a sardine, they will eat a sardine. They like salmon. They like tuna. There's all kinds of things that you can feed your dog. You don't necessarily have to give them steak every day. They might like pork. I mean, my dogs love bacon. But again, you have to decide, but make it fun for them. My dogs eat eggs. Sometimes I'll cook them. Sometimes they're raw. So you just have to decide what you want to do for your dog. If you're going to go with what I would call a kibble, I don't want to call it a kibble, but maybe you want to do some freeze-dried or air-dried food, which is basically on the carnivore or on the keto spectrum. So if you feel good about that, but usually, I'm just being honest, when I've looked into an air-dried or a freeze-dried food that resembles a carnivore diet, it comes to about $20 a pound. And so I'd rather just give them the real McCoy. I mean, I could buy them organic grass-fed beef for much cheaper than that, $20 a pound. Jake says, hey, Lucy, Jake says his dog likes his steak medium. So Madge said, opinion about acupuncture. In my opinion, in my experience, I have no experience in acupuncture. I think if it helps you, go for it. Okay. Bonnie says she gets eye injections for retinal edema. What kind of injections are you getting? Why do you have retinal edema? Jake says, in America, no one believes you're an MD until you get a prescription. I mean, that is the service that doctors provide. And that's, the patients have been cultivated or cultured to expect a prescription when they go to the doctor. The doctors in America, including my previous self, that was my job description. You make a diagnosis, you pat yourself on the back, and you are so well versed in what medications that, what to use, what medication for what. We are good in knowing what medications treat certain things that we diagnose. If you go to the doctor and you get labs or you get a diagnosis, that's why you go to the doctor, you get a diagnosis, and then the diagnosis is treated. And it's treated with a medication. So if that's what you want to do, if that's how you see your healthcare, then that's what you should do. Go to a doctor, get a diagnosis, and get the medicine. Melanie, have a good day, Melanie. Chat with Lucy says, yes, he loves sardines, canned salmon, love my pooch. Awesome. I love to hear that. Lucy says freeze-dried. Yes, freeze-dried or air-dried. There's different versions, and you can look at the ingredients. Obviously you want to look at the ingredients, but the least amount of ingredients, a lot of them will already contain the organ meats. They'll contain, they'll either contain beef or chicken or turkey or pork or whatever you would like to have in them. And then maybe a few other things. You might say, I don't mind my dog having pumpkin. It just depends on what you are willing to give your dog. Are there essential carbohydrates? No. Jake says, are you a medical doctor? I am I'm family practice, yes. I went to medical school. I went to I took a family practice residency. Gideoni says, every doctor who's good at their job is akin to a witch or sorcerer. What is the symbol for a medical doctor? What is pharmakia? Yes, study point, I am. Hey, doctor, my back hurts. Doctor, here, take this pill once a day. Wow, my back pain is gone. Sorcery. Right? Wayne says, I feed my dogs beef and beef liver. My red tick hound is 18 years old, still running around like a pup. That is so wonderful, Wayne. Thanks for sharing. All right. I love to hear that. Jake says, I recommend Ollie. I've actually tried Ollie. I've also tried Farmer's Dog, but I don't go for any of those anymore. I stopped. There was way too much extracurriculars in there that I didn't want my dogs to have. Chris asks, how do you bring triglycerides down? Fatty liver. No carbs. Right, Jake. Yep, they're treating the symptoms, not the cause. That's exactly right. Okay. Denise says, what about milk thistle? What about it? I don't know. Okay. Instagrammers, there's no questions over here. I get this question a lot, and it adds to, is GLP okay to take? I've heard that microdosing is good for me. Okay, why are you taking a GLP? And are you aware of side effects? You have to know the pros and cons of anything that you take. Anytime you take a medication, it is blocking a normal biologic process in your body. We have a certain amount of GLP in our body, right? If you are obese or you have type 2 diabetes, that amount is much less. That's why they're using, as in pharmaceuticals, have made GLPs in supra-physiologic doses. And you guys who are taking GLPs, you are the guinea pigs. There are no studies on the amount of high dose that people are taking at this point in time. You guys are the guinea pigs. So let us all know, how's it going with your GLP? Do you know that it shrinks heart muscle? Do you know that it shrinks your musculoskeletal system, muscle and bone? Do you know it causes eye problems? Do you know that it can cause thyroid cancer? Do you know that it can cause malnutrition? I mean, anytime you tell people to stop eating, so you're going to go from eating 1,200 calories of whatever to 500 calories. Do you not think that that is going to cause malnutrition? Do you think that that is not going to cause sarcopenia? And if you're not getting protein, you're not going to be making good bones. You know, your bone health will be diminished. I mean, there's a lot of things that you guys need to look into before you just go, ooh, I think I would just like to control my appetite. There's so much more. But again, you know, if you know it all and you want to take a GLP, then I say go for it. Go for it. What are the three main, what are the causes of insulin resistance? Is that the question? We're talking about insulin resistance now? Okay, insulin resistance is when insulin is very, very high in the bloodstream. You cannot have insulin resistance without hyperinsulinemia. You can have insulin resistance, hyperinsulinemia. You can have inflammation. You could have stress. Those are the three main causes of insulin resistance. Insulin resistance, by definition, is hyperinsulinemia. Okay? Inflammation and stress, those are increasing insulin resistance. Stress, how does it do it? Cortisol, sympathetic overdrive, increases blood glucose levels, increases insulin. There's your hyperinsulinemia. Inflammation caused by elevated blood sugar. Elevated blood sugar increases insulin. Insulin builds up in your body. You know, that's insulin resistance. How can we improve insulin resistance? Get more muscle, eat less sugar, decrease inflammation. It sounds like, you know, common things, but again, that's, you know, you have to know that what is causing your insulin resistance. And I will tell you that you can only get insulin resistance by getting hyperinsulinemia. And this goes along with the insulin resistance. What diet makes you fatter? So you want me to tell you what will make you fatter? Or what are you asking? I'm not sure. The diet that will make you the fattest is the one that increases the most insulin. You cannot get fat without insulin. Insulin is the driver. It'll tell you how much fat. If insulin is high, it will continue to push energy. You have to have energy. That is a goal. You have to have insulin on board. You just are having too much. Hyperinsulinemia is insulin resistance. Okay? So on what diet will make you the fattest, it will be the diet that raises insulin the most. The more insulin resistant, i.e. diabetic, the fatter you are going to be. Okay? You cannot get fat without insulin. Look at a type 1 diabetic who doesn't dose themselves with insulin. They could eat however much energy they want, and they will never get fat. Fat does not make you fat. Eating fat does not make you fat. In fact, fat increases your metabolism. It does not make you fat. Fat is a metabolic driver. It is only things that raise insulin. Fat does not release insulin. There's no sugar, so it doesn't cause insulin to be secreted. If insulin is high, your fat cells will get fatter. The energy, whatever it is, will be pushed into the cells. That's what makes fat cells fatter. And then eventually the fat cells get so fat that they can't take anymore and they become resistant. If you continuously try to drive insulin high, to drive energy, i.e. sugar, into the cell, it will start to leak or explode. It will leak out things like cytokines. You'll get high levels of inflammatory markers like interleukin 6. It'll release fatty acids. It's going to leak. It can't get any bigger. It's the only time that you'll have lipolysis going on at the same time that insulin is high. Otherwise, when insulin is high, things are getting fatter. Okay? If you are a person who doesn't have very many fat cells, then wherever you have the fat cells, they are going to get bigger. If you're eating energy, meaning carbohydrates, my modest protein can increase blood sugar modestly. Fat, not at all. Ken says, makes me wonder why you went MD and not DO. What do you mean? Oh, that's funny, Madge. That is funny. You guys are, okay, I see you guys are arguing over an MD and a DO. The training, the curriculum for a DO and an MD are exactly the same, with the exception of DOs get some training, get quite a bit of training in OMM, osteopathic manipulative medicine. OMT, osteopathic manipulative treatment. They're getting some extra, but the curriculum, every doctor, whether you're an MD or a DO, is exactly the same, and it's underwritten by the pharmaceutical companies. So whether your doctor is an MD or DO, from an educational standpoint, they all got indoctrinated into whatever the pharmaceutical companies wanted them to be indoctrinated into. Naturopaths do not get that kind of training, obviously. They've been put to death by a number of people in our past from the early 1900s moving forward. So that is why there are not very many naturopaths, and that's why chiropractors are basically non-existent. They're getting more and more because schools are popping up. But yeah, the only difference between an MD and a DO is some specialized training for DOs during medical school. They may or may not use those specialty training in their practice. I never did. I went to a DO medical school and I took an MD residency. Why? Because it was where I wanted to stay in practice. There wasn't a DO residency at the time in family practice where I wanted to live. And so I took an MD. I took MD boards and an MD residency. Every doctor is different. Some go straight through DO. Most MDs do MD residencies and MD boards. It's DOs that might veer off depending on location, because there are 7 states that don't allow, I believe, don't quote me, but I believe there are 7 states that do not allow a DO to practice in their state if they did not take DO boards or a DO residency. You know, Michigan, Oklahoma, Florida, Hawaii, those are some of the states. Let's see. Bubba's asking about Rapatha. What is your question, Bubba, on Rapatha? Sounds like we got a lot of people in the medical field listening in. Let's see. Any other questions, you guys? I'm going to skip to the bottom on YouTube. I'm going to go directly to the bottom and look for questions moving forward. Okay. Can I eat fruit? I think I already answered that question. You can eat fruit if you want to eat fruit. If you know all the consequences of eating fruit and all the benefits of eating fruit, then have at it. That is up to you. I don't tell people what to eat, okay? Let's shift gears and talk a little bit about fat tissue, since many of you are asking about fat. J. Michael, hello, Dr. J. I'm sending you an email later today. Awesome. I look forward to hearing from you. So, fat is an endocrine gland. Okay, it is part of the endocrine system. It does release hormones. They're bioactive. Fat releases hormones. They are called adipokines, like adipose tissue, adipokines. They are hormones secreted by fat. There's numerous adipokines, but there's very common ones that we can talk about, but you know, if you guys got specific questions about adipokines, I will just give you maybe 4 or 5 of the most common adipokines. One is leptin. You might have heard about leptin. Leptin is produced only in fat and usually in subcutaneous fat. It's not released very much from visceral fat. So subcutaneous fat releases leptin or secretes leptin. Leptin is very, very important for fertility. So a woman who has very, very low leptin levels, she will likely be infertile. Leptin really tells the body that it's time or you are able to get pregnant. If leptin levels are low, and there are defects in our ability to make leptin, but sometimes you can see it in very, very skinny, thin, women, and they have very low leptin levels. Their leptin levels might be 2 or 1, 2, 3. They get full very, very easily because their leptin is so low. So they will be full and they'll have to eat small, frequent meals. They'll always say, oh God, I'm so full. And you think they're crazy because they're skinny. Why don't you just eat a cheeseburger, they'll say. Well, that they can't. Their leptin level's so low that they're getting full quickly. And so for them, eating small, frequent meals is in their best interest, but that woman is also likely having trouble getting pregnant if she is in her fertile years. Another adipokine is adiponectin. And actually, adiponectin is highly functioning. It's actually a sign of metabolic health. And adiponectin is lower in people with obesity. I know that sounds because they got a lot of fat, right? But adiponectin is something that will increase insulin sensitivity. It's going to make you more glucose tolerant. All right. Adiponectin also decreases inflammation. Remember, inflammation is one of the causes of insulin resistance. And adiponectin also supports fat metabolism. So it's going to increase lipolysis, breakdown of fat. When do we get lipolysis? When insulin levels are low. How do we get insulin levels low? Low or no carb diets. All right. Another adipokine, another bioactive hormone that is secreted by fat, is something called PAI-1. Plasminogen activator inhibitor 1. Plasminogen activator inhibitor 1. It is secreted mainly by visceral fat. And this particular PAI1 inhibits the breakdown of blood clots. So that is why people who have fatty liver have an increased risk of coronary artery disease, have a higher risk of having a heart attack. Why? Because they lack TPA, tissue plasminogen activator. That is not a good thing. Tissue plasminogen activator is needed to break down clots. So let me give you a scenario. We are talking about coronary artery disease and what builds up or increases your risk of having a heart attack or increases the risk of plaque formation. An injury has to occur in the glycocalyx. And once that glycocalyx is thinned out or injured where it's not protective anymore, then injury, if it's continuously, like sugar, like smoking, like heavy metals, like nanoplastics, that injures the glycocalyx, and then the endothelial cells are exposed. The endothelial cells have an ability to protect themselves. If they were to get injured, there is a mechanism by where what we call stem cells. Our bone marrow will try to produce baby progenitor endothelial cells. So little baby cells will be released from the bone marrow to help out the amount of injured endothelial cells that's going on in the inner lining of the artery. But if the bone marrow can't keep up with the baby progenitor cells, then a clot will form, okay? And a clot will help heal the injury, just like if you cut yourself on your hand and a clot formation, a scab, and then that heals underneath and the scab falls off and everything is good to go. The skin is brand new. That should happen in our arteries. You have an injury, it destroys the glycocalyx, it gets maybe to a destruction or an injury to the endothelial cells, a clot will form. And that clot attracts a whole bunch of stuff, a lot of debris like platelets and white blood cells and red blood cells. All of that helps to solidify or make a blood clot to heal that injury. Now, over time, if there isn't enough material, chemicals, molecules in your body to break down that clot, then that clot can stay, it can get calcified, and then plaque begets plaque. But if that plaque doesn't get calcified and it's got a soft core, that core can break off and cause that blood clot can go downstream, heart, lungs, brain. So back to PAI inhibitor, tissue plasminogen activator, TPA, inhibitor. So you're inhibiting TPA. So now you're inhibiting the breakdown of blood clots. And now you have more blood clots that can go places. So people with visceral fat releases PAI-1, plasminogen activator inhibitor 1. So they have a higher risk of blood clots. They have a higher risk of cardiovascular disease. Hopefully this makes sense. Okay, another adipokine, another hormone, bioactive hormone that is released from fat is called resistan. Resistan is linked to insulin resistance. It's very high in people with obesity and especially with people with visceral fat. So resistan, R-E-S, so resist, A-N, resistan, okay? Another one is TNF alpha. It's also pro-inflammatory. So most of these adipokines are in the negative. Then there's angiotensinogen. Angiotensinogen is also an adipokine. It is a hormone that's secreted by fat. And angiotensinogen is the precursor to angiotensinogen 2. I don't think you guys really need to know all of this stuff, but I'm just trying to get you to picture that your fat in your body releases hormones. And all those hormones have a role in our body. There are some that are good, like adiponectin and maybe leptin if you're wanting to get pregnant. And then there's some that are bad, like PAI inhibitor 1 or angiotensinogen or TNF alpha, which is very inflammatory. So it's important to keep in mind that your adipokines can be good for you or bad for you. And to think that your fat is not endocrine is the wrong way of looking at it, because it is. What is the difference with brown fat? Brown fat is very metabolically active. Subcutaneous fat is not metabolically active, okay? It isn't. In fact, brown fat is probably 10 times more metabolically active than white fat or subcutaneous fat. So going from the outside in, you have subcutaneous fat, which is either superficial or deep. And superficial subcutaneous fat is actually safer than deep subcutaneous fat. And then you have visceral fat, which is really, really bad. That is the fat that's around your organs. Now, brown fat is usually in our neck and chest area. When we're a baby, most of our body is brown fat because it's metabolically active, because babies don't have muscle. They need to how they're going to stay warm, because brown fat is metabolically active. It produces heat. It doesn't do much else besides produce heat, okay? And so it protects the baby. That's why a baby is able to survive. You get it out of a bath or something like that. It's brown fat keeps it warm. So brown fat also produces no leptin. So that's why, you know what? Babies can't get pregnant, right? So they have less subcutaneous fat, more brown fat. Can you get brown fat over time? Good question. I don't think you can make white fat into complete brown fat, but I think you can get an in-betweener. I think you can get beige fat. I think beige fat can be made in our body. I think that if you do alternating cold and hot therapy, you can increase your production of brown fat. What makes it brown is mitochondria. So let's see. Any question on, white fat versus brown fat? Does that have anything to do with thyroid? Yes. Yep. Brown or white fat or brown fat? Brown fat does. When brown fat is more active, you're going to get more active thyroid. You're going to get more conversion of T4 to T3. T3 is the active form. T4 is not. So as a review, in our thyroid sits in our neck. In our thyroid, 100% of the T4 is produced by the thyroid. Okay? So in our brain, pituitary hormone, TSH, thyroid stimulating hormone, TSH, is produced in our brain. It comes down and tells the thyroid, it stimulates the thyroid to produce T4. 100% of the T4 is made in the thyroid. About 20% of the T3 is made in the thyroid itself. The remainder of the T3 comes from the conversion of T4 into T3. Okay? Can T4 only go to T3? No. Some T4 can be converted to reverse T3. When you're checking your thyroid, you should get a TSH, a free T3, a free T4, and a reverse T3. You should know all of those levels. It's very important. You cannot just get a TSH and know what's going on in your thyroid. That is, I would say that's malpractice. The doctor should be ordering all of them. Okay? So going back to brown fat and increasing our thyroid hormone, so it's increasing the conversion of T4 to T3. This really ramps up when we get brown fat. And when we get brown fat, usually we're doing cold activated increasing of brown fat, which is not really all brown. It could be beige. Okay? I don't think you can go back to being an infant. All right. Those are good questions. Those are good. Are there any other questions? Anybody have a question on fats? Anybody have a question on adipokines, the hormones that are released from fat? Any questions on brown fat versus white fat? All right. Okay, you guys, it looks like the questions have stopped, and we will, yeah. Okay. It doesn't look like there's any more questions on Instagram. So we'll call it quits today, and we will be back for Saturday live stream at 9 a.m. Central, Sunday 10 a.m. Central. If you have questions and want to contact me at IronLadyDoc@AOL.com, IronLady, IronLadyDoc, D-O-C, at AOL.com. Okay, if you want to sign up for a consultation, we can go over your labs, we can go over your diet, we can go over your exercise routine. If you want a list of labs that you want your doctor to order, email me. I'll send you a list of labs. If you want me to order your labs, I can do that too, because your doctor won't. I would be happy to do that. There are a few states that do not allow you to order your own labs. I think Rhode Island is one. Is New York one? I know Rhode Island for a fact is not one of the states where you can order your own labs. Jabrowski asked about fatty liver. Let's go over that. We did go over that a lot before. Fatty liver is caused by high insulin. High insulin is caused by carbohydrates in excess. Okay, so you can email me. I can email you back a list of labs if you want me to order them. I will email you a cart of labs, and you can pay for them and do your thing. It doesn't affect me one way or another. If you want me to go over them with you, sign up for a consultation. That does affect me. Okay. Lee, I do not know the answer to that. I'd have to look it up, but thanks for asking. Okay, so if there's not any further questions, it looks like they're kind of drying up. Liz, I will look into that question, but yes, the answer is yes. It does have a mechanism of correlation. Ken, I don't know the answer to your question. Okay, guys, we'll call it quits today. For sure. Catch me for reels. If you don't already subscribe, please do so. Hit the thumbs up, hit the hearts, hit the likes, fix the algorithm. You guys know how to do the clickety-clack. But thanks for joining Dr. J's Prescription for Health, where your health takes center stage. You guys have a great day. See ya.